You see, in the case of Dharunaga, you see, we are giving, in all Dharunaga cases, we are prescribing some oils upon the scalp without giving internal medications. Scientifically, if we are treating a patient, we should be able to identify the case with respect to Ayurvedic profile. The Dharunaga is a presentation of kledha accumulated over the scalp. That is due to Pradulomada. So, we should be able to give proper Sanamsana and proper Anulomana, Amavajana, and along with that, if you are washing the scalp with the Tripaladi Kashaya, then the patient will be getting a proper result without recurrence. Without recurrence means the patya should be very, very important. About the food pattern, we will describe in another session. The patyas in skin diseases. So, by discuss the session regarding the discussion, we will discuss about these factors. In the case of every skin disease, whatever may be the presentation, whether that may be psoriasis, lichen planus, eczema, or lupus erythematosus, like so many conditions are there, cutaneous manifestations are there. So these manifestations should be addressed in line with our own profile. So in the case of psoriasis also, we should be able to identify the patient with respect to paachana. Initially, we are giving rasapachana and raktapachana drugs in the case of psoriasis. After giving paachana only, we are switching on to the Devana drugs, and after that, in Ashtanga-Kriya, there is a reference that Pajani Devane Snehestan Swedescha Parishkritan. You see, Pajani Devane Swedescha Pajani Devane Snehestan Swedescha Parishkritan Shodhane Shodhe Kale Yathasannam Yathabalam. Before going for a Snehana therapy or Panchakarma therapy, Pajani Devane is a very important factor. That basic principle is not considered everywhere. We are directly giving Snehapana and we are giving a Virajana, and after that we are giving Rasayana. Before that, we should give proper Pajana and Devana drugs. In the case of chronic cases, the time span for Pajana is not 2 or 3 weeks. We should give 2 or 3 months Pajana or Devana drugs. After that only we can give Snehapana and Shodhana. This is a case of urticaria. In the case of urticaria also, Amavajana is very relevant. We are giving Rasavajana drugs, Kalinga Gampara, Patola Sepatram Gadugironi. That combination is very relevant in the case of Rasa, Gada, Ama, and we are prescribing the medicine for this. You see, after that, Dosha Vridhi is very important. These are the lakshanas of Dosha Vridhi, Vadiga, Paitika, and Kapaja. You can see Shava, Irina, Khara, Visarpani, Toda, Veda, Swaba Yukta lesions are the Vadiga lesions, and Raga, Osha, Josha, Vaida, Dhuma, and Sweda, Prapaga, Bheditwa, Krimija. These are the symptoms of Paitika Doshadushti and the Kapaja Doshadushti also. I am not explaining in detail. These are the factors you can see in classics. So, some Gatha lakshanas also we can see in classics. For example, Tochi Spudana Rukshade, dislodged vata from the koshta will result or will manifest upon the skin as cracked foot. Toji Spudana Rukshade. Spudana and Rukshana are the symptoms of dislodged vata upon the skin. So while we are examining a case of cracked foot, we should be able to remember or remind this quotation that Toji Spudana Rukshada. Doosheevisha is the manifestation of dislodged vata from costa to plantar skin. So there are two main pathology events are there. In pathology, we can see two relevant pathologies. Vata dislodged from the costa and located at the level of plantar skin, which is very vulnerable to dislodgements. Why the skin is vulnerable? That skin is dehydrated and that skin will be having some irritant contacts, and the other pathology at the level of costa is the dislodgement of vata. The vata dislodged from the costa, so we should be able to give medicines to reverse the direction of vata inside his costa. For the reversal of vata inside his costa, we should give some medicines. And for the prasadana of the plantar skin, we should give some topical therapies and we should give internal medicine also. So the medicine which is having both results, that is the costa annulomana and rasa prasadana or tvak prasadana, that medicine can work here. Like that, these are some examples I am just mentioning here. Through going through some examples, we can focus upon the basic principles which are very relevant in the case of cutaneous manifestations. So in the case of Gathadosham, we should be able to identify the involved events in pathology, and we should be addressed both factors, and we should be able to give medicine for that. You see, Dhaathu Gata Kushta. Dhaathu Gata Kushta lakshanas are the Mamsagada Kushta. In the case of Mamsagada Kushta, we can see in the palmoplantar region, there will be pustular lesions. Palmoplantar regions, there will be pustular lesions in the case of Mamsagada Kushta. So you see palmoplantar pustular psoriasis is the case. So in the case of palmoplantar psoriasis, after giving a proper Samsana and annulomana drug, we can go directly enter to Mamsapajana Kashaya described in the case of Vishamajara. That Mamsapajana will give amazing result in the case of palmoplantar pustular psoriasis. This is the palmoplantar psoriasis. You see, these are the diagnostic considerations while we are addressing a case of cutaneous manifestation. While considering the diagnosis, we should be able to Dhaathu Vaishamya. Symptoms of Dhaathu Vridhi and Dhaathu Kshaya may be seen in the case of Srothodushti. Usually Dosha, Rakta and Mamsa Dhatus are involved, or Srotas are involved, and the Srothodushti Lakshanas are also seen in the case of the involvement of Dosha, Rakta and Mamsa. Asraddha, Aruji, Asivairyam. Like that, the Srotho involvement symptoms also will be there in the case of Rasa involved cases. So, while asking the history, we should be able to assess the case with respect to the Ayurvedic profile. Then only we will be able to prescribe medicines for the prasadana of this Srodasas also. In the case of skin diseases, krimi is a very relevant factor. The involvement of krimi, other than the dosha and Dhaathu, the Sapta Dravyas involved in Kushta, the involvement of krimi is mentioned very particularly in Susruta. Assess this chance of krimi nidana and infestations. If the patient is having the chances of krimi nidana, then essentially it should be avoided from the patient. Nidana parivarjanam chikitsa. So, if the patient is having the chances of nidana of krimi, then essentially he should be advised to avoid that krimi. In the case of Tinea albicans, the facial, the macular rash over the skin, whitish discoloration, hypopigmentation is due to the activity of the fungus over the skin, tinea albicans. So you see, in the case of this is the opportunistic infection, and as a result of the vitamin deficiency, the fungus gets opportunity to invade over the facial skin, and that eats the melanocyte from there, and that is why he is having hypopigmentation. So the opportunity should be avoided from the body. Then only the tinea albicans activity will be reduced. So the patient, the child should be administered with proper nourishment, and the vitamin deficiency should be corrected initially. Then only the activity of fungus will be reduced. This is a case of tinea cruris. Tinea cruris is the infestation or a fungal infection that is due to the moist atmosphere there, and due to the sweat coming out without any proper decomposition. Then we should be able to give proper internal purification drugs which are having the property to purify the internal atmosphere of the body. Along with that, we should avoid the external moisture condition with some added drugs. This is also tinea cruris. We should be able to reduce the moist atmosphere externally, and internally we should be able to give some proper purificatory drugs. This is also a involvement of tinea versicolor. This is also a opportunistic infection. This opportunity the organism gets due to the improper internal atmosphere. So internally we should give some purificatory drugs. I am not mentioning again and again purificatory drugs. We can give purificatory drugs as Padola Mooladi Kashaya, and as paachana drugs Padola Gathadosham Kashayam, and Panjayuktam Kashaya is a very good paachana Kashayam. Nimbadi Kashaya is a very good paachana Kashayam. After giving a proper Samsana or Anidomina, we are prescribing paachana Kashaya initially. You see, in Matrashidiyam Prakarana, there is a reference that we should treat the patient with drugs which can reverse the nidana or samprapti. After that only, we should give some specific medicines advised for that particular condition, for particular srotas or dosha. In the case of kushta, we can see kushtinam snehavanena purvam samyak upajaretu. Kushtinam snehavanena purvam samyak upajaretu. Then you will assess that every kushta case should be treated with snehavana. That is not a correct consideration. You see, before giving a snehavana chikitsa, we should be able to give paachana and devana drugs. So, nidana parivarjanam and samprapti vigatanam should be the initial line of treatment. So, in the case of this also, krimijanma, we should give proper paachana devana drugs initially. This is also a Doosheevisha, the lichen planus healing phase. In the case of Doosheevisha, in the case of lichen planus, we are treating the condition in line with the Doosheevisha. That a patient will be having a latent pathology inside his body. If he is having an initial manifestation, then atmospheric changes and changes in food habits, the chances of recurrence is there. So we should consider the case of lichen planus as a Doosheevisha, and after proper shodhana means proper samsana and anilomana and paachana, proper paachana, we can switch on to some Doosheevisha drugs, pipillary drugs. Some drugs are there in this Lodhra Sevyadi Kashaya described in Luta Chikitsa. These are the Visha drugs suitable to use in the case of Ayurvedic dermatology. There are so many Visha Prakarana drugs. We can take suitable drugs from the paraphernalia of the Visha also. See, this is a prurigo nodularis case. Prurigo nodularis. Prurigo nodularis is a psychodermatological case. Psychodermatology means the underlying pathology is very much related with the psychological reasons. So the patients will be having strong psychological alterations or psychological irritations inside their body due to some specific reasons. So in these types of cases, the diagnostic principle should be very much related with the sattva of the person. So we should be able to identify the relation with the sattva while asking the history of the case. While asking the history, if that is a chronic skin disease with which may have some strong psychological reasons, we should treat that case with counseling also. This is the case of contact dermatitis and nidana parivarjana, the avoidance of the nidana or tight watch or tight undergarments like that. So we should be able to alleviate from that also. So in this session, I am trying to focus upon the diagnostic considerations mainly. Diagnostic considerations means we should be able to identify the pradulomata of the body, amatva or samatva of the body, dosha vridhi or Gathadosham inside his body, Gathadosham, Srothodushti, krimi janma, sattva, Doosheevisha, nida. These are the factors very relevant in the case of diagnosing. While we are diagnosing a cutaneous manifestation, these are very relevant factors. We should be able to identify or we should address the patient with respect to these factors. Then only we will be able to administer or manage the case with respect to Ayurvedic principles. Otherwise, some specific medicines suitable for some specific conditions we will select and we will prescribe. We will think that in the case of psoriasis we should give Manjishtadi Kashaya or Nimbadi Kashaya. In the case of eczema or Vijarchiga we should give Shonidamradam Kashaya or the Guluchadi Kashaya. Like that we will think. It is not a scientific treatment. If we should give a scientific treatment, we should be able to identify the case with respect to these factors, and our treatment is the reversal of these considerations. We should be able to give medicines which can reverse these pathologies. Like that, Samprapti Viketanam Chikitsa. This is the basic principle behind the prescription. So, you prioritize the pathology or prioritize the Samprapti of the patient. Each and every patient sitting before you, one psoriasis case may not be equal to other psoriasis case. One eczema will not be able to other eczema case. Two lichen planus cases are very much different. Like that, for every patient, you should collect the Samprapti inside his body, and we should be able to reverse that Samprapti with prioritizing it. In some cases, Anilomata will be okay. Pradulomata will not be there. Anilomata is there. So, he is having proper Anilomana, and we should not give Anilomana drugs. In some cases, Amavajana is very relevant. In some cases, Amavajana may not be that much relevant. You see, in case of acute pathology means the cases within 3 months. In those cases, Amavajana or this samsana are not that much relevant. So some symptomatic reversal drugs may work. For example, in the case of an acute urticaria for 3 or 4 days, in those cases it is not necessary to consider the case with the all the basic principles and all. So in that case, we can prescribe some Amada, Vrishabhadoladika Kashaya or Histandin tablets like that. That will give results, and we should not think very enormously about that. But in the case of chronic skin diseases, it is very relevant to think that case with respect to the concept of Ama, Anilomana, Dosha, Dosha, like that. So for every patient, you should prioritize. You should make a list of Samprapti Ghatakas with respect to the priority of the involvement. Upashaya, don't underestimate the power of Upashaya and as diagnostic tool. Upashaya is very important. Amavajana, Amavastha or Anilomata or Doshadushti or Srothodushti, all these factors can be assessed with the help of Upashaya also. We can give some medicines internally, or we can apply some topical drugs also. Then by assessing the response of the treatment, the Upashaya drugs, we can reach at a particular clear-cut diagnosis. So within 1 hour, I have tried to focus upon the diagnostic principles mainly. This is the basic principle, and I have tried to bridge the gap between the theory and the practice. In our clinical practice, you see, in our clinical practice, we are utilizing drugs which are having the property to reverse the pathology inside the body, reverse the Samprapti Ghatakas inside his body. Then only it will be very scientific. We should be very scientific in our treatments. So, with that, let me conclude this session